9 alarming signs you are eating too much salt. Although the Dietary Guidelines for Americans recommend less than 2,300 milligrams of sodium per day, Americans consume 3,400 milligrams. If you're like most people, salt sneaks into your diet without you even realizing it. From processed foods to restaurant meals, sodium levels in our daily intake are soaring, and the effects may be downright scary. I used to think salt was harmless. It's just seasoning, right? But as I dug deeper, I realized that excessive salt may wreak havoc on your body. That's why in today's video, I will talk about 9 alarming signs of eating too much salt. As always, consult with your healthcare provider if you notice any of these signs or want to make changes to your diet. Now, let's get started. 1. Frequent thirst. Sodium, a key component of salt, plays an important role in regulating the balance of fluids in your body. However, when you consume too much of it, your body has to hold on to extra water to dilute the excess sodium in your bloodstream. This is where the feeling of intense thirst comes in. When the sodium levels in your body rise, your cells lose water in the bloodstream to help balance things out. As a result, the tissues in your body become slightly dehydrated, and this sends a signal to your brain that you need more water. Thirst is your body's way of telling you that it needs help to correct this imbalance. The kidneys also play a big role in this process. When you consume too much salt, your kidneys work overtime to filter out the excess sodium. However, this also causes them to retain water in an attempt to dilute the sodium and restore balance. This process makes you feel thirsty, as your body signals for more fluids to help flush out the extra sodium. In a trial published on PubMed, 412 adults consumed different sodium levels. The study found that higher sodium levels made people feel more thirsty, no matter which diet they were on. This result was consistent for everyone. 2. Swelling and bloating, edema. Eating too much salt may lead to swelling and bloating, a condition often referred to as edema. When there's an excess of sodium in your system, your body tries to maintain equilibrium by retaining more water. Essentially, sodium draws water into your tissues from your bloodstream, which causes that characteristic puffiness or bloating, especially in areas like your hands, feet, ankles, and even your face. This is because the extra water pools in your tissues, creating visible swelling. What's even more concerning is that this swelling isn't just a superficial issue. While it might look like just some extra puffiness, the buildup of fluid may strain your circulatory system. This added pressure may make it more difficult for your heart to pump blood efficiently, potentially leading to more serious health problems like high blood pressure or heart disease over time. Swelling may also make you feel uncomfortable and sluggish, and the bloating in your abdomen may add to that heavy, sluggish feeling after eating. According to the National Library of Medicine, edema occurs when fluid filters out from the arterial end of the capillary. As hydrostatic pressure decreases, fluid moves back into the capillary from the surrounding tissues, driven by the oncotic pressure gradient. 3. High blood pressure. When there's too much sodium in your bloodstream, your body retains more water to dilute the salt. This increase in fluid leads to a higher volume of blood circulating through your body. Think of your blood vessels as a system of pipes. If you push more fluid through those pipes, the pressure inside them rises. This increased blood volume forces your heart to work harder to pump the blood, and the added strain on your arteries causes them to stiffen over time, which leads to high blood pressure. The kidneys, which are responsible for filtering your blood and balancing sodium levels, also take a hit. When you consume too much salt, the kidneys can't remove all the excess sodium efficiently. As the kidneys struggle to keep up, more fluid remains in the bloodstream, causing even more pressure on your blood vessels. This cycle may continue to worsen, making high blood pressure a chronic issue if salt intake isn't controlled. High blood pressure, also known as hypertension, is often referred to as a silent killer because most people don't feel any immediate symptoms, even as the pressure inside their arteries rises. Over time, this increased pressure may lead to serious complications like heart disease, strokes, and kidney damage. The constant strain on the blood vessels may cause them to weaken or rupture, leading to life-threatening conditions. It's not just a matter of feeling uncomfortable. It's about protecting your heart and other vital organs from long-term damage. The World Health Organization defines excessive sodium consumption as more than 5 grams of sodium per day. It has been demonstrated that excessive sodium consumption leads to a significant increase in blood pressure. 4. Kidney stones. Normally, your kidneys work to keep a balance between the calcium in your body and the calcium that gets excreted through urine. But when you consume too much salt, your body ends up excreting more calcium along with the sodium. The higher levels of calcium in your urine increase the likelihood that calcium will combine with other waste products, such as oxalate or phosphate, forming kidney stones. These stones are hard deposits that may become lodged in your kidneys or urinary tract, causing intense pain and potential blockages. What makes this even more concerning is that once you develop kidney stones, you're at higher risk of getting them again, especially if you continue to consume a high-sodium diet. The recurring cycle of too much salt leading to high calcium levels in the urine means that the stones may continue to form, causing long-term issues with kidney function. According to a study published in the International Journal of Molecular Sciences, a large observational study of 3,757 chronic kidney disease patients followed for nearly 7 years found that those with more urinary sodium excretion were at a higher risk of the disease progression. 5. Frequent urination. Eating too much salt may lead to frequent urination, and the reason behind this has to do with how your body tries to manage the excess sodium. When you consume large amounts of salt, your body reacts by trying to flush out the extra sodium to maintain a healthy balance. Another aspect of frequent urination from excessive salt intake is its impact on fluid balance. When your body holds onto more water to dilute the sodium in your system, it may eventually reach a point where it needs to release that excess fluid. This causes more trips to the bathroom as your body tries to restore a normal fluid balance. It's a cycle where too much salt leads to more fluid retention, followed by the need to get rid of that fluid, resulting in frequent urination. You might also notice that this frequent urination tends to happen more at night, a condition called nocturia. This may disrupt your sleep as your body continues trying to rid itself of the excess sodium while you rest. Over time, this not only becomes an inconvenience but may also contribute to sleep deprivation, which has its own set of negative health effects, such as fatigue and decreased focus during the day. In a study published in the Journal of Pharmacology Sciences, high salt intake was found to cause urinary storage dysfunction. It indicates that high salt intake affects urination by upregulating the epithelial sodium channel in the bladder. 6. Muscle cramps. According to the theories mentioned on PubMed, there is a positive association between sodium levels and muscle cramps. Muscle function relies heavily on proper electrolyte levels. Sodium helps your muscles contract, while potassium helps them relax. If there's too much sodium and not enough potassium, the muscles may become overstimulated, leading to cramps. Essentially, when you flood your body with too much salt, you're throwing off the electrical signals that control muscle movement. These signals rely on the right balance of sodium and potassium to keep your muscles functioning smoothly. Another reason excessive salt leads to muscle cramps is dehydration. When you eat too much salt, your body tries to retain water to dilute the sodium, but this process may also leave your muscles dehydrated. Dehydration makes it more difficult for muscles to contract and relax properly, increasing the likelihood of cramps. Without enough fluid, muscles are more prone to tightening and cramping because they can't get the nutrients and oxygen they need to function properly. 7. Digestive issues. The role of salt in digestion is more complex than people often realize. While a small amount of sodium is necessary for helping the body absorb nutrients and maintain fluid balance, too much may cause significant harm. High salt intake increases the risk of inflammation in the stomach, which may eventually damage the protective lining of the stomach. This lining acts as a barrier, preventing stomach acid from damaging the tissues underneath. When that barrier is compromised, the acid may start irritating the stomach wall, leading to a burning sensation or pain, particularly after meals. Excessive salt intake has also been linked to an increased risk of developing ulcers. These are sores that form in the stomach lining when the tissue becomes too damaged to heal properly. A diet high in salt may not only irritate the stomach, but but also make it more vulnerable to infections by harmful bacteria such as Helicobacter pylori, H. pylori, which is known to cause ulcers. High sodium levels create an environment that allows these bacteria to thrive, increasing the likelihood of ulcer formation. In addition to ulcers and acid reflux, consuming too much salt may also contribute to bloating and digestive discomfort. Sodium affects the balance of fluids in your body, and this includes the digestive tract. When there's too much sodium, your body retains more water to try and dilute the excess salt, which may lead to a feeling of bloating or fullness. This water retention in the digestive system may slow down the normal movement of food, leading to constipation in some cases. What's even more concerning is that long-term, high-salt diets have been associated with a greater risk of developing serious gastrointestinal issues, such as gastric cancer. Over time, the chronic irritation and inflammation caused by excess salt may lead to changes in the stomach lining that increase the risk of cancer. This is especially true when combined with other risk factors like smoking or heavy alcohol consumption. According to a review published on PubMed involving over 268,000 participants, those with a median salt intake of 3 grams per day have up to a 68% higher risk of developing stomach cancer compared to those with a median intake of 1 gram per day. 8. Decreased cognitive function. Eating too much salt may lead to decreased cognitive function. Sodium plays a role in maintaining the balance of fluids in the body, but when consumed in excess, it disrupts this balance, which may have a negative impact on blood vessels, including those in the brain. The brain depends on a steady supply of oxygen-rich blood to function properly. When blood flow is compromised, whether by high blood pressure or damage to the blood vessels, it becomes harder for the brain to get the oxygen and nutrients it needs. This reduced blood flow may gradually impair cognitive abilities, including memory, concentration, and decision-making. Essentially, the brain becomes less efficient because it's not receiving the necessary resources to perform at its best. One of the more serious long-term effects of too much salt is the potential for vascular dementia, a condition caused by damaged blood vessels in the brain. This form of cognitive decline occurs when the brain doesn't receive enough blood, often as a result of chronic high blood pressure linked to excessive salt intake. Over time, this may lead to permanent changes in brain structure and function, making it difficult to perform everyday tasks, recall information, or even communicate effectively. According to the National Library of Medicine, a study involving 319 participants found that higher salt intake significantly increased the risk of cognitive impairment. Compared to the low salt group, the risk increased by 75% in the mild intake group, 180% in the moderate group, and 330% in the high salt group. 9. Weakened bones. Eating too much salt may lead to weakened bones, and this happens because of the way salt affects calcium levels in your body. Calcium is essential for maintaining strong bones, but when you consume excessive amounts of salt, your body excretes more calcium through urine. This calcium loss over time may contribute to a decrease in bone density, making your bones more fragile and prone to conditions like osteoporosis. When you eat salt, the kidneys filter out the excess sodium to maintain balance in the body. However, this process doesn't just remove sodium, it also causes the kidneys to pull more calcium from your bloodstream into your urine. This calcium isn't being used for your bones anymore, it's simply being flushed out of your body. Since calcium is one of the main minerals that keep your bones strong, losing too much of it weakens your bones over time. The more salt you consume, the more calcium you lose, which is especially concerning for older adults or those who are already at risk for bone-related issues like osteoporosis. This condition, characterized by low bone density and fragile bones, becomes more common as we age, and a high-sodium diet may accelerate its development by continuously depleting calcium reserves that are crucial for bone health. A study published by Nature explains that osteoporosis, which weakens bones and raises the risk of fractures, may be worsened by high salt intake. Now, let's see how you can manage your salt consumption. I get it. Salt adds flavor and makes meals more enjoyable, and like you, I love a good salty snack every now and then. If you're like me and want to take better control of your salt intake without sacrificing taste, There are simple changes you may make that go a long way toward improving your health. 1. Read food labels. Processed foods are one of the biggest sources of hidden sodium. Make it a habit to check the labels for sodium content. You'd be surprised how much salt is lurking in things like sauces, soups, and even bread. Aim for low sodium or no salt added versions when you can. 2. Cook at home. When you cook your own meals, you control how much salt goes into your food. Start using other spices and herbs like garlic, lemon, pepper, and rosemary to flavor your dishes. This way, you're not relying on salt for taste, but still getting delicious meals. 3. Cut back on processed and packaged foods. Pre-packaged snacks, frozen dinners, and fast food are loaded with salt. Instead, opt for whole, unprocessed foods like fruits, vegetables, lean proteins, and whole grains. These naturally contain less sodium and are much better for your overall health. 4. Watch out for condiments. Things like ketchup, soy sauce, salad dressings, and other condiments are packed with sodium. Try to limit how much you use or go for reduced sodium versions. Even better, make your own sauces and dressings at home where you may control the ingredients. 5. Rinse canned foods. If you use canned beans or vegetables, make sure to rinse them under water before cooking or serving. This helps remove some of the excess sodium that's added during the canning process. 6. Gradually reduce your salt use. Cutting out salt all at once may be tough, especially if you're used to eating it regularly. Instead, try to reduce your intake gradually. Over time, your taste buds will adjust, and you won't miss the salt as much as you think. 7. Use salt alternatives. If you're craving that salty flavor, try using salt substitutes like potassium chloride or other sodium-free seasonings. These may give you a similar taste without the harmful effects of excess sodium. 8. Check restaurant menus. When dining out, ask for dishes with less salt or request sauces and dressings on the side. Many restaurants offer low-sodium options, but you often have to ask. Being mindful of your choices when eating out may make a huge difference. 9. Hydrate more. Drinking more water may help flush out excess sodium from your body. If you're feeling bloated or thirsty from too much salt, staying hydrated will help your kidneys process and excrete the excess sodium more efficiently. 10. Set a daily sodium limit. Most experts recommend aiming for less than 2,300 milligrams of sodium per day, with an ideal limit closer to 1,500 milligrams, especially if you have high blood pressure. Track your intake for a few days to get a sense of how much sodium you're consuming and adjust your eating habits to stay within that range. So, there you have it, 9 alarming signs that you might be eating too much salt. If any of these symptoms sound familiar, it might be time to take a closer look at your diet. I know cutting back on salt may seem tough, especially with how much it's hidden in our everyday foods, but trust me, your body will thank you. Take charge of your health now. Your future self will be glad you did. And remember, if you're unsure about where to start or think you might be at risk, always consult your healthcare provider for personalized advice. Now that we have discussed the many signs of too much salt, there are always other signs of health we should look out for. From the kidneys to the pancreas. Interested in learning more? Watch 10 warning signs of bowel cancer you should not ignore. Or watch 11 bad daily habits that are ruining your liver. Watch one, or even better, watch both. Will you be taking care of salt consumption from now on? Let us know in the comments below.